Joining me now is the Government Minister, Nadhim Zahawi. Mr Zahawi, always a pleasure. Thank you for joining us on the programme this morning. I know that you're not going to tell me what the details are of the plan, and you'll say I'll have to wait to hear what the Prime Minister has to say. I can ask you, though, will it fix the problem?
Well, I think successive governments have attempted to come forward with plans and have never quite delivered. I think this Prime Minister is determined to actually fix the broken social care system. Now, you can't address the social care system in isolation because you need to make sure that integration between health and social care is completed. So you have to also make sure that the NHS has the funding it needs to be able to fix the sort of the shorter term difficulty of the pandemic, which is why last night we announced an additional 5.4 billion for this 6 months on top of the 6.6 billion for the previous 6 months of additional spending to allow the NHS to make a real dent into that backlog, the 5 million that John Craig just described in the backlog. And of course, we estimate about 7 million people haven't come forward, and I would urge them to also come forward for their operations. It's really important. You know, we put 1 billion into dealing with the backlog in the last 6 months of elective surgery. We've doubled that to 2 billion on the announcement yesterday. So you've got to do both things. You've got to make sure the NHS has the funding it needs to deal with the cost of COVID and, of course, enhanced hospital discharge. That's getting an additional just under 500 million. And, of course, what the Prime Minister will announce to Parliament. And I think it's right that he does that in Parliament, and then there's a press conference with him and the Chancellor and the Secretary of State for Health later on today to give the details on how the social care system that so does require reform. 1 in 7 people, Kay, pay over £100,000 for their social care. If you have assets of more than £23,350, then your social care costs can be absolutely backbreaking. So it has to be dealt with. And I think this Prime Minister will not shirk that responsibility, and he will set out his plans today.
And in answer to my question?
So your question around social care, how are we going to...
No, my question was, will it fix the problem? It was a very straightforward question.
Well, I think, look, as I said, I think you have to at least have a really good go at making sure you fix the problem. The social care system...
So not necessarily then?
Well, it would be presumptuous and I think completely arrogant to say, of course, Kay, it will fix the problem.
He said he had a ready-made deal ready to go 2 years ago on the steps of Downing Street.
Well, no, right. So there's two different things. It's really important. The right thing to do is to deliver the reform of social care and the investment into social care. You've got to make sure then that is operationalized, as we did with the vaccination program. You know, when I came on your program and when I took on this role,
let's deal with vaccination later on in the conversation. Let's just deal with whether or not this is going to fix the problem. Labour says it's not. They say it's only going to benefit 3 to 5% of people who need it.
Well, I think actually, when you see the details of what the Prime Minister will set out, you'll see that this is a Prime Minister who's serious about fixing the problem. I'm just being respectful and cautious in that, you know, and not being arrogant to say, oh, of course, yeah, everything will be fixed in 5 minutes. It won't. Both in terms of the backlog, we will tackle it. We want to reduce it, but it will increase before it gets better. But we're putting the resources, the money that we announced yesterday, the additional 5.4 billion, taking the total, by the way, for this year alone of additional support to the NHS to 34 billion pounds, will go some way to addressing the backlog. In the same way, I'm not going to be arrogant.
Twice you've talked about the amount of money. Twice you've talked about the amount of money that's going to the NHS, 5.4 billion, which was announced yesterday. The Health Foundation says it's a drop in the bucket, and the NHS needs at least 17 billion pounds to sort out that backlog.
Well, the 5.4 billion is for this 6 months. There was 6.6 billion in the previous 6 months.
So more forthcoming if necessary.
Well, as I say, it's really important that we deal with both the NHS getting the funding it needs and...
Yeah, my specific question is whether there'll be more money forthcoming for the NHS if necessary.
if necessary, of course, we will continue to look at what the NHS needs, because you've got to fix both. You can't fix social care without having an NHS that is actually fit for purpose.
Of course, I get that. And you're making a pledge today to my viewers on the programme. National insurance, you said, as a party in the manifesto, would not increase, and yet it looks as though that's what you're going to do. Are you completely comfortable with that?
Well, let's wait and see what the details that will be set out by the Prime Minister
unless
later
you've got a money
today.
tree, you're going to have to get it from somewhere. You've said that you're not going to put up national insurance as part of the manifesto. Would you be comfortable if the Prime Minister decided that was the only way to pay for this social care?
Well, I don't want to preempt the Prime Minister or speculate.
I'm not asking you to. I'm just saying, if that's what happened, would you be comfortable with breaking a manifesto promise?
But let's wait and see what the Prime Minister set out. The important thing is to remember.
How would you feel about breaking a manifesto promise, though?
Well, look, I want to meet every single manifesto promise that we make. That's the right thing to do. We have gone through an unprecedented shock to the economy because of the global pandemic, and we've had to deal with it and make some really, really tough decisions. But I don't want to preempt what the Prime Minister will announce or what the Chancellor will say in the press conference later on today. Very happy to come back on your show and discuss how we're going to pay for it. The important thing to remember is that this Prime Minister will set out the plan that I think will finally, after successive governments attempting to do this and failing, this Prime Minister will actually deal with this and deliver the funding that will fix the broken social care system that many people...
Even if that means breaking manifesto promises. What about the triple lock for pensions? That was another manifesto promise, I believe, that would stay in place. Are you going to break that promise too?
Well, first of all, no one is in the business of wanting to break any promises. There's been, if you look at the triple lock that's been in place and it's been in the manifesto, the Chancellor will set out any spending plans. It would be absolutely premature and I think wrong for the Minister for Vaccine Deployment to be setting out...
You're representing the government today, Minister. You're not here as the vaccine minister. You're representing the government today. I'm putting it to you on behalf of my viewers that many of them voted for your party because you made those manifesto promises. I'm asking you, are you comfortable? I'm not asking you what the Prime Minister is going to say. I'm asking you, are you comfortable with breaking 2 manifesto promises potentially?
I'm not comfortable with breaking any manifesto promises. What I'm saying to you, Kay, is that whatever we do in terms of the finances of this country and getting the country back on its feet, as the Chancellor has done, 407 billion has gone into that safety net to protect the economy, 8 billion into welfare. The Chancellor will set out our spending plans and will explain how we're paying for the social care reforms that we'll introduce, which will finally, I hope, begin that sort of road to dealing with the social care problems that we have faced for many, many years, if not decades.
Got it. Talk to me about an area that you're much more comfortable with, and that is vaccines. The Eye newspaper reporting this morning that the government is planning an October firebreak if hospital admissions stay high. Is that something that you would endorse?
So the vaccines have actually allowed us to reach an equilibrium with the virus in the sense that they have prevented over 100,000 deaths, many, many millions of infections, and of course, hospitalization as well. The upward pressure on infections is, as obviously we've reopened the economy to pretty much as close to normal as you can get. But obviously schools...
Answer my question?
I'm absolutely going to answer your question.
We only have a finite amount of time. You're going to be here all day at this rate.
No, hold on a second. So the booster program that we've had the interim advice from the JCVI on is my absolute priority. That will protect the most vulnerable to serious infection. That will absolutely help us to transition this virus from pandemic to endemic status. The important thing is we get that right, because I think if we do that well, we can continue on this sort of one-way road towards sustaining the opening of the economy and by next year, hopefully transitioning this virus from pandemic to endemic and dealing with it on an annual basis. The thing to do is to remain
Okay.
cautious.
Let
to
me try
remain
this one then. Let me try this one. Let me try this one. Suggestions that school half-term could be extended from 1 to 2 weeks because those pesky little biters are the one that keeps spreading this virus. Is that a good idea?
So I think that the right thing is that we open schools. We've opened them well with the really comprehensive testing program, and we want to make sure they stay open. And the way you do that is by protecting the most vulnerable, which is why my focus is on the booster program. I don't want to adjust the half term or go back to any form of lockdowns, because that's the worst thing we can do to the economy and to people's livelihoods. The way to deal with
so
it.
not ruling it out. Let me ask you about the migrants crossing the Channel yesterday. We were contacted by the Home Office last night telling us that it wasn't 1,000 migrants crossing the Channel. So they obviously know how many it was. Can you tell us this morning?
No, what I can tell you, though, is that we are working with the French authorities. They've increased the number of patrols, and of course, they're doubling the number of police and enhancing the technology. But in the long term, it is the Nationality and Borders Bill that I think will make a real difference, which again, this government is the government not to shirk this responsibility. It's a tough challenge. You know it's a tough challenge, but we are dealing with it. And that Nationality and Borders Bill absolutely lays the foundations for dealing with this issue in the longer term in a sustainable way. But we're working with the French authorities to make sure that the shorter term fixes are also enhanced as much as we can.
Do we know what nationalities these people are?
Varying nationalities, as you know, from many countries.
I just wonder if any of them might be Afghanis and whether we would treat them differently.
Well, as you know, the Prime Minister and the Foreign Secretary gave a comprehensive statement, two statements to Parliament on the work that we're doing to continue to enhance what was an incredible evacuation program of 15,000 people in about a fortnight, which is a testament.
We paid the French authorities £54 million to deal with the situation to try and stop migrants crossing the Channel. It was a record number yesterday. If you can't give me the number, some suggesting 1,000, you're saying as a government it's less than that, but you can't tell me how many. As I say, we paid the French £54 million to manage the situation, and this was a record number. Are we getting value for money?
Well, I think the work that the French authorities are doing is incredibly important. I think it's right to continue to enhance that, and the conversations we've had with them is to really sort of hold them to account on the enhanced measures that they will be taking, doubling the number of police and increasing the ability of the tech to help. That is the short-term fix. The much longer-term fix is through the Nationality and Borders Bill, which I think
is that a yes or a no? In the meantime, is that a yes or a no? 54 million quid, and we've got a record number of people crossing the Channel yesterday. Is that a yes or a no for value for money that we've given the money to the French?
I think we have to continue to look at.
You're not saying no, are you? You're not saying yes.
What I'm saying is we have to hold them to account. We've gone to our colleagues to say, how are we doubling the number of police officers? How are we enhancing the technology? How are we dealing with this in the short term? But in the longer term, it is through our legislative system that we can introduce, as we have done, just like social care. This Prime Minister did not shirk the responsibility, nor did his Home Secretary, to deliver the Nationality and Borders Bill that will ultimately, in the long term, deal with this. And